My name is Mills-Blane, and I am the co-founder and CEO of Infusion Partners 360. We are an infusion nurse registry located here in Corona, California. I'm often asked, what is a nurse registry? My simple explanation is that a registry is like a staffing agency for nurses. In the traditional business model, nurses staff hospitals. In our case, we specialize in contracting nurses who are experts at delivering medication by injection, more commonly referred to as infusions. Instead of the services being provided in the hospital, the nurses provide infusions primarily in the home setting. As a registry, IP360 coordinates temporary work assignments on behalf of our clients who are specialty pharmacies, home health agencies, and infusion centers. The pandemic has caused my company to pivot strategically and make adjustments as we had to rethink and reimagine how we would do business in order to survive. Because we are in healthcare, our priority has been to keep our commitment to keeping nurses safe during this time, as well as the patients. As such, we had to implement new processes that would help us adhere to the recommendations for Centers of Disease Control and Prevention and to the World Health Organization to prevent the spread of the virus first and foremost. Then we had to add additional PPE policies and procedures to make sure we were keeping our nurses and patients safe. Due to the governor's stay-at-home order, like many other businesses, we had to shift our internal workforce immediately to a virtual environment within 72 hours. We experienced a drastic decrease in the number of referrals we received. And in addition to this decrease in referrals, there are many factors that played into this and our ability to service our patients at the same level as prior to COVID-19. We had nurses that did not want to enter a patient's home for fear of contracting the virus. We had nurses that could not provide the services if they were suspected to be in contact with someone who had the virus. We experienced patients who wanted to create very demanding environments that made it almost impossible for nurses to provide the care in the home. And some patients began to request nurses who worked in the hospital to not come to the home at all. So it decreased our network of nurses that we could pull from to provide the services. So overall, our situation looked different. We had to think outside the box. We had to do something different. And as a company, we had to figure out how do we meet, because we're still in healthcare, the unmet needs of our community. And this introspection has resulted in new service offerings for us. We had to think different. And that yielded two business entities, which is a home health agency, as well as an infusion center, to be able to continue to provide these services so that patients could still receive these services without having to have them at the hospital. I would like to just challenge you all to think about things that you could do to help your businesses pivot during this time. You know, are there additional service offerings that you can provide? Can you align yourself with the social distancing recommendations? Can you provide virtual reach to your clients or customers? Can you improve your technology to help you reach your clients or customers? Try not to go too far off base so that your clients don't recognize who you are, but try to do something slightly different so that you can sustain. And make sure that whatever it is that you're doing, you give some thought to ensure that it is sustainable and profitable. I hope that you've enjoyed our discussion for today. And if you would like to discuss further with myself or anyone from my team, please feel free to visit our website at www.infusionpartners360.com. That's www.infusionpartners360.com. Thank you.